Ladies and gentlemen, this is an article that came out on NPR. Amid spike in measles cases, health officials warn of losing decades of progress. And yeah, America did make some progress in keeping a lot of these diseases under control, but they have never been eradicated. Okay, under control, I will say, but not eradicated. So this came out November 30th, 2018. If you take the long view, international health organizations have much to be encouraged about when it comes to the global fight against measles. From 2000 through 2017, for instance, the annual number of measles-related deaths dropped 80% from the toll of over 500,000 to just 110,000 last year. But lurking inside those statistics, published Thursday by the World Health Organization and the Center for Disease Control and Prevention, are some of the far less rosy numbers, specifically what's been going on recently. The report found that cases from the highly contagious disease spiked more than 30% from 2016 to 2017. The World Health and the CDC say there are 173,330 officially reported cases worldwide last year alone, though they believe that those numbers represent a fraction of the actual number. In general, the number of reported cases reflect a small of the true number of cases occurring in the community. The World Health Organization has previously explained the organization uses a statistical model to estimate the actual number. Many cases do not seek health care or, if diagnosed, are not reported. In addition, there is a 1 to 2 month lag time in reporting. In this case, the model estimates the actual number of cases last year would be 6.7 million. Wow. Health officials believe they know the root of the growth. Without urgent efforts to increase vaccination coverage and identify populations with unacceptable levels under or unimmunized children, we risk losing decades of progress in protecting children and communities against this devastating but entirely preventable disease. Interesting. Measles has menaced humans for more than a millennium, an infectious killer capable of causing fatal complications such as pneumonia and encephalitis, particularly in children. Measles have nevertheless faded from global fears in the 5.5 decades since a vaccine was introduced in the United States. In fact, the disease was declared eliminated in the country in 2000, and deaths from it have also fallen steeply worldwide since then. But medical experts say those global successes have depended on the vaccine. Regions that do not have high rates of vaccine coverage, whether due to a lack of access or conscious rejection by parents, are susceptible to a rise in measles, even relapses in areas where the disease had been nearly or entirely eliminated. In the United States, for instance, 220 measles cases have been reported so far this year as of November 3rd, according to the CDC. There were 86 cases in all of 2016. I agree. I think those numbers are lowball. I really do. I never think they give the correct numbers. And the European Union has seen a measles outbreak that epidemiologists had tied to falling rates of vaccination due to the occasional erratic vaccine supplies and anti-vaccine movements. For the first half of this year, the WHO says more than 41,000 children and adults in Europe were infected with measles. In other words, nearly double the cases recorded all of last year, which in its own right was the highest annual total in years. The disease has also reestablished a presence in other countries that had once declared measles free, such as Venezuela and Russia. Since 2016, measles incidence has increased globally in 5 of 6 WHO regions. The organization notes, adding that only the Western Pacific region has avoided the larger trend. The increase in measles cases is deeply concerning, but not surprising. Seth Barkley, CEO. Okay. Complacency about the disease and the spread of falsehood about the vaccine in Europe, a collapsing health system in Venezuela, and pockets of fragility and low immunization coverage in Africa are combining to bring about a global resurgence of measles after years of progress. You see how they threw Africa in there? But Europe has a problem with measles in Africa. Existing strategies need to change, more efforts needs to go into increasing routine immunization coverage and strengthening health systems, he added. Otherwise, we will continue chasing one outbreak after another. So there you go. I'm not surprised. Like I said, they never truly eradicate these diseases. You may see less of it in the world, but it's there. But please tell me what you think, ladies and gentlemen. Please leave, subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.